Hello, everyone. I'm coming to you from the West Coast of the United States, so it's bright and early in the morning for me. Don't mind me if I have my morning tea here while we chat. I'm very happy to take questions in the Q&A. I'll just speak for a few moments and try to give a somewhat accessible introduction to all of this. Certainly, MAIHDA can be quite technical when you get really into the weeds on it, but at its heart, it's a fairly simple idea. So I'm hoping it'll be, quite accessible for everybody, regardless of your background. So, as Dario said, I am coming to this with an interest in health inequalities, but the methods that I've been working on developing really have applications across the health and social sciences. So, if anyone here in the audience is, coming from education or even economics, political science, whatever your background, there might very well be applications there as well, though mostly I'll be talking about health and health inequalities. So, to get us started, for those who are less familiar with multi-level modeling or those who just want to orient themselves with multi-level models, the basic idea here is we're going to be doing some statistical analysis. And in multi-level models, back when I was a grad student and before that, the conventional use of these models was to allow us to handle the fact that sometimes in a large sample of data, some of our people, for instance, our students in our schools or residents in different neighborhoods, workers in different workplaces, will be clustered in some way. And that shared environment might be an important thing to think about. Maybe we're interested in studying it for itself. Maybe we just want to adjust for it in our statistical analysis so we can estimate something else with some better accuracy. So the rationale for using multi-level models like this is that, for instance, when people are within the same environment, kids are going to the same school, they might have correlated outcomes. So, if you have some number of kids in your data set and they go to a certain number of schools, in a statistical sense, you might have a smaller sample size than you were really thinking, than the number of kids there, because their outcomes are correlated. They're nested in this shared environment. But typically in multi-level models, we often think of these clusters as being something sort of concrete, a built environment, or at the very least, a social environment, something that's really easy to see and recognize. One of the nice things about multi-level models, as we'll see a bit more later in the talk, is that they allow us to think not just about inequalities between students or between residents or workplaces, but to think workers, but to think about differences across environments. So we can think about variation around these averages, both within a school, for instance. We can have variation and inequality among kids within a school, and we can also have variation across clusters of schools. So we get to think about variation as well as average differences, which is a nice feature here. So if you walk away with nothing else today, I have sort of two big ideas. Big idea number one to take away from today is we do a lot of work around estimating inequities and inequalities across health and social sciences. I think we can do it a little bit better. If we're going to do it in a quantitative way, I think we can get slightly better estimates in a slightly more diverse and meaningful way that's more in line with the interests that we have around equity. So I think we can do a slightly better job than we've done in the past. And also, we can use multi-level models for this. So multi-level models aren't just something that you have to imagine really concrete environment clusters like schools or workplaces. They can be applied to handle much more abstract types of clustering, by which I mean we still are going to think of people as having correlated outcomes and sort of sharing a positionality. But we might imagine something a little bit more abstract. So for instance, if we're thinking in terms of intersectionality, people might share by virtue of their gender, race, ethnicity, socioeconomic status, age, disability status. They might share a positionality within these interlocking systems of oppression, within these hierarchies, and that could have implications for their health and well-being. So in other words, we can think of these clusters as being intersectional points of positionality or identity. In an even more abstract way, we can think of high dimensional interactions, and that's what's moving us a bit beyond intersectionality into the realm of other kinds of research and study designs. So I will tend, just a note on language, to refer to these clusters as strata or social strata or intersectional social strata. I chose that term rather than groups because, at least in America, I'm not sure about the Americas, group can have a bit of a loaded context, like assuming that anyone who shares a gender or race ethnicity is somehow a cohesive social group, as if they all know each other. That could have implications you don't quite mean. Social strata, on the other hand, is sort of a nod to stratified analysis, where we understand that these aren't necessarily naturalistic categories, but for the purposes of analysis, we're going to go ahead and stratify our sample in order to make comparisons across groups. Now, this isn't actually a stratified analysis, but conceptually, it's sort of like that. So I've chosen to use that term. So I'm going to structure the next handful of minutes around some key questions here. These are things that come up a lot in this work and will hopefully be a pretty gentle introduction to all of this. So starting out with, why on earth are we doing this in the first place? Why would we study high dimensional interactions? Why should we be thinking about intersectionality in our health inequities research? And then, don't we have a good enough approach for doing this already? Why would we need a new approach? Some fancy new stats thing I have to learn in order to understand intersectional analysis now. And then number three, this is just a clarification I have to make every talk I give because it's probably the biggest conceptual stumbling block as we do any kind of quantitative intersectional analysis. That includes MAIHDA and also other kinds of analysis. And that is the difference between intersectional experiences in a sense that we might theorize it, and then how that might leave a footprint on an outcome we are studying, so interaction effects. And then I will close with some discussion of what are the goals of a quantitative intersectional analysis? How does MAIHDA help us there? And to illustrate this, I'm going to give you a couple of nice concrete examples that you can walk away with and think about. So to get us started, why on earth are we doing this? Why are we studying high dimensional interactions? Well, again, I'm coming to you from health inequalities research. And if you pay attention to any of the big theories in the field, theories like fundamental causes of health inequalities or social production, political economy of health, Nancy Krieger's eco-social theory, really, they all kind of say it in different terms, but a big theme that comes through in all of these social epidemiology theories is that we need to pay attention to multiple axes of marginalization and to socioeconomic inequity. So it's important to think about gender/sexism and racism, xenophobia, homophobia, etc. And we see similar themes crop up in other fields. So for anyone who might be coming from a not purely social epi background, anything in the social sciences, health and medical sciences, social work, certainly environmental sciences, environmental justice work, we see a lot of similar themes come through there. And then it's no surprise that for some number of years now, people have started importing intersectionality as a theoretical framework into these conversations because it asks us to think about theorizing inequities together. So it's not enough to just think about multiple axes of marginalization and socioeconomic inequality. You need to think about how they create intersections, how they form interlocking systems of oppression. So to give credit to the amazing Black feminist scholars, Patricia Hill Collins, Kimberly Crenshaw, and others who have pioneered this field of intersectionality. Intersectionality is a critical theory, much like critical race theory or queer theory. It is a critical theory and a analysis framework. It's certainly not just quantitative. In fact, its origins aren't quantitative, but we're moving it into the realm of quant here. The idea here is that those inequities we are interested in are created, are produced by these interlocking systems of oppression. So you imagine, some highway intersections across all of these different axes of oppression, privilege, and it cuts both ways. So it's not just disadvantage, but also privilege and advantage as well. An important thread in intersectionality, of course, coming out of Black feminist scholarship, is paying attention to and centering the experiences of the multiply marginalized. Traditionally, Black women, of course, but this framework has been expanded to think about other people who occupy marginalized positions or who mix in their positionalities some marginalization with privilege. So again, it's important to think about many axes of marginalization. If we're really leaning into this theory, it's not enough to just say, okay, race, ethnicity, and gender. We need to think about sexuality. We need to think about age. We need to think about any number of things. And then very important to retain here is a focus on transformation. It's not enough with intersectional scholarship to just describe what's happening and leave it at that and wash our hands of the situation. We should use this as motivation to challenge those institutions, those systems of oppression with transformative aims. In other words, we want to make the world better. So as we take this theoretical framework and we bring it into the realm of quantitative analysis, some useful terms are intercategorical comparisons. So Leslie McCall had a nice sort of description of various types of intersectional scholarship, which include, anti-categorical. We're going to critique all label making in the first place, and it's been an amazing branch of work. Or intra-categorical, where we will pick some particular social group or positionality to really focus our attention on, perhaps with qualitative or mixed methods work. And then intercategorical, which is what we're doing more here. Again, we sort of provisionally adopt some kind of categorization or labels in order to divide up our sample and estimate how big the inequalities between them might be. And important as we sort of wade into this is remembering that while we are using these markers of identity or status, we aren't really thinking of them as having meaning originating in, say, a body in a biological determinist sense. What we mean by it when we say we're looking at, Black and woman, is that these are proxies, the best we might have in our survey, perhaps, proxies for the kinds of social experiences that someone with those identities or positionalities might have out in the social world. And very importantly here, in a quant world, we are explicitly rejecting an additive approach. So if we're interested in quantifying some health status for Black women, for instance, it's not enough to just add up the effect, quote unquote, of being Black and being a woman. You need to have an interaction term of some form in there. So you can have a unique estimate for Black women and not be assuming that the inequality gap is the same for Black women versus Black men, for instance. So question 2, why on earth do we need a new approach? It seems like we have methods that would do this already. It's not actually that complicated. We're just calculating some average differences here. So another term I'll use is fixed effects approach. So the conventional approach, I will also call this the single level regression model approach. It's fairly simple. So as quite a basic example, if we just are comparing non-Hispanic, Black, and white participants and women and men, so just 4 categories, very simple model, we might set up a model like this. We have some outcome for person I in our sample, and then that's going to be equal to some combination of beta terms, intercept representing our reference group here, which would be white men, and then an effect for women, Black, and woman times Black. Now, again, this allows us to estimate a different outcome unique to each of these 4 social strata or 4 groups. So the beta 1 for woman here is actually, based on how we've set this up, specific to white women versus white men, and so on and so forth. So certainly we can absolutely do the model this way. I actually still do it this way if I'm doing a very simple analysis, sometimes just a few categories. There's nothing inherently wrong with this. But as you start to lean into intersectionality, there are some critiques and some problems that show up. So some sort of theory-oriented critiques are, first of all, there's something about the setup of this that rubs people wrong sometimes. We seem always to be putting our most privileged reference group, usually rich white men or highly educated white men, as our reference category. Are we somehow, by using them as the yardstick against which everyone else gets measured, somehow subconsciously reinforcing their social primacy as if this is the default human and everyone else is just permutations on that theme? So that's certainly a critique that has been floated here. There's also something about this, and I don't know if this is like a quirk of human nature or brains, but you set up a model like this, you estimate all these different betas, and then almost immediately what happens is we look at it, we all do this. We're like, which one's bigger? Is it beta 2 or beta 1? Okay, does that mean it's really race or really gender? And so we immediately revert to this single axis thinking when the entire purpose of the intersectional framework was to say, you cannot separate these systems of oppression. They are interlocking. So it doesn't, in a sense, really matter which one's bigger. You are theorizing them as inseparable. So yeah, setting it up like this, we tend to revert to that single axis thinking. And then number 3, there's something about this that, sure, we could change our reference group, but we seem to only be getting an intersectional interaction effect for, in this case, one group, right? Black women. What if we're interested in intersectional experiences for our most privileged population? What if we're interested in those who are sort of mixing advantage and disadvantage? We could, again, multiply change our reference category, but that's a bit cumbersome. And it's also not quite getting at what we're interested in. But in theory, what we are interested in with interaction effects, to my mind, is departures from expectation. Here, it's set up as departures from white men. What we're interested in really is departures from typical patterns and expectation. So could we do that a little bit better? We also run into some big methods limitations here. So first of all, if we, again, start off with only 4 categories, it's not too much of a problem. But if we really take intersectionality seriously and lean into it, we might be adding hundreds of beta terms. And everything you add, you have to add all the permutations of interactions. You can get 2nd order, 3rd order, 5th order interaction terms. So as you add predictors, the number of interaction terms is going to explode, basically. It's going to increase geometrically. You get a lot of issues here with scalability. You want to scale up your analysis to include more things. It's going to be a problem for model parsimony. You also have the small sample size problem, the thing we are always, moaning about here in quant world. Once you start slicing and dicing your sample into lots of tiny groups, you might end up with some intersections that have 10 people in them, 5 people in them, 1 person, right? The end of one problem. And so you're going to get some pretty unstable estimates. There's no thing that's happening in this model that adjusts for sample size. It will just happily calculate an average for you based on 1 person. So basically, it's just giving you back your observation of that 1 person. And there's no way of knowing, is that 1 person's answer really representative of an entire group? So yes, you definitely get small sample size problems. We also get what Juan Merlo has called the tyranny of the averages problem. So again, we're putting a lot of emphasis on averages and average differences and less focus on variation around those averages. So 2 populations might have a subtle average difference, but their distributions could be almost perfectly overlapping. So is it really fair to say this group is high risk and this group is low risk? It's worth paying attention to the variances as well as the averages. And then finally, perhaps this is just me, but I think others share this problem too. As soon as you put 400 betas in there with 5th order interaction terms, I struggle to understand what my results are telling me. Like, that's just a lot to interpret. So interpretability becomes a problem as these models become more unwieldy. So fine for small numbers of comparisons, really struggling as we get into more broad types of comparisons. So enter intersectional MAIHDA, which for those who are struggling with that mouthful of an acronym, it stands for Multilevel Analysis of Individual Heterogeneity and Discriminatory Accuracy. No, I did not come up with that acronym. I originally just called it the multi-level intersectional method, but that was perfectly fine in my dissertation. But it has taken on this title over time, and I see the value of that. So as I've mentioned, the core idea here is we have a multi-level model, pretty standard, but used in an unconventional way. We're going to be defining each of these clusters or social strata to be each unique combination of whatever categories and variables we're interested in. So for instance, we might have one stratum that is representing Black women who have college degrees or more. They are high income. They are 30 to 44 years old. Another one in the analysis might be white men with less than high school education, low middle income, 45 to 59 years, and so on and so forth for every combination that we are considering. So as a very simple introduction on this, again, we wouldn't necessarily want to fit a multi-level model where let's say you only had 4 schools and to treat school as a level. Similar here, we wouldn't necessarily want to do this with only 4 strata at our level 2, but just for the purposes of simple illustration, let's sort of stick with this. Here is our same fixed effects single level model for women and men, Black and white, and all of the 4 groups. So for the MAIHDA approach, we might typically sort of fit 2 models. There's what I call the null model or the empty model. So we have our outcome, Y, for individual I in social stratum J. We have a overall grand mean, precision weighted grand mean. So this is sort of the average across all of the strata. And then we have mu0J. This is how much is the average expected predicted value for this particular strata different from that overall average. So in other words, it's getting at this idea of departure of this stratum from the average overall. And then within each strata, we can have individuals with a bit of variation in their scores. So in this, we are defining that mu0J, we have one of these estimated for each of our, in this case, 4 strata. And this is going to follow not much of a normal distribution with only 4 of them, but assuming there were more, a normal distribution mean of 0 because it's centered on that average, and then some variation around that average. We might have a few in the tails that are really far away from that average. We might have others that are more clustered around it, departing only slightly from that overall average. So we're going to have a measure of between stratum variation. I'll show you visually what this looks like in just a moment. And then for each of the individuals within each of these clusters, we have some within stratum variation as well. So that's sort of overall what's happening. But then model 2, we would add back into it just the additive main fixed effects. So we would put in here in this simplified example, woman and Black, but no interaction effect. So if we do that, what we've said is, here's the difference across these strata. Here's how much of it is accounted for by the additive stuff. So the departure that's left over is an interaction effect. So this interaction effect, which is estimated for each of our strata, is kind of analogous, though a different number, to this one. Again, this is a particular intersection just for Black women comparing with other groups. But this is sort of like an interaction saying relative to what we might expect if it was an additive world, how much is this strata actually showing up as being different from that? So there's not much in here that's terribly surprising. Basically, we still have additive effects. We still have interaction effects. We're just partitioning it all slightly differently than we would up here. But it's not much magic. It's the same concept. We have additive and interaction effects. So this looks a lot more complicated. Why on earth are we doing this? Why is it worth doing this? Why do we need this new approach when the math looks a little bit harder? Well, let's start out with this. I've taken just in this simple simulation, 30-ish thousand people and divided them up into different numbers of strata. So that really simple example we had with 4 of them, there's not much difference between the 2 approaches, the multi-level MAIHDA approach and the fixed effects approach. Here, we're plotting Bayesian information criterion. So this is a measure of how well the model fits, but BIC penalizes the model and gives you a higher score if you've gotten that goodness of fit by adding tons of things into your model. So of course, you can have perfect fit to your data if you put thousands of betas into your model. So it's basically balancing goodness of fit with how parsimonious your model is and saying you're getting a lot of benefit for adding this additional factor in. So as you can see, when you start out at sort of lower values here, the 2 approaches are pretty similar, as we might expect, but very rapidly we see a departure between them. So as we get up into, dozens or, even 384 strata, the Bayesian information criterion stays pretty low and pretty stable for multi-level, which is a good thing. That's saying this remains parsimonious, but you're getting a lot of good model fit. The fixed effects model explodes, more or less as we would expect. So in other words, the multi-level approach gives us a lot more scalability to include all of those things that theory and our own empirical interests might ask us to include in our analysis. We get a lot of good model fit for relatively few things getting added to the model. The reason for that, just going back a slide, is, again, we're not putting in all of the interaction effects. Here, it's not such a big deal because we only have one interaction effect, But if we start adding in just other additive effects and no interactions, we could keep it in the realm of, for this one, I think it was something like 13 or so beta terms versus 384 beta terms for the fixed effects model. So also, human level, fewer parameters means it's easier to understand your results, which is a good thing. So here I'm just going to say, take my data. This is coming to you from a new tutorial I just have out this year, a MAIHDA tutorial, and it has code in it. So feel free to download it and play around with it in R or Stata. So this is some simulated data looking at hemoglobin A1C, so a measure of average blood sugar. And in my sample, I might have this sort of distribution. I have some people with really low hemoglobin A1C values and some with high, and I might get some sort of interesting skew here. And I've just got an overall sample mean of about 40.2 millimoles per mole. Here I'm looking at percent of people in my sample. So as I'm thinking about variation differently in my different models, this is a bit of a snarky question, but with the fixed effects approach, am I just taking my sample and fitting a regression model with 384 betas in it? And is that really just a fancy way to calculate a bunch of averages? Yes, it kind of is. In theory, you could add other things into your regression model as well. But conceptually, what you're doing is you're taking your group of people and you're splitting them up into a bunch of different bins. So, this particular group over here, and each of these has their own distributions. And you're just using this and saying, for this group, what's the average? For this group, what's the average? And you get a bunch of averages. You would basically get the same thing if you asked whatever program you were working in to give you some massive cross tabulation in a frequency table. Just give me the mean at each of these combinations of factors. It's the same thing. This just ends up being a fancy way to get at it. And you can see that if you think about expected values. What is the expected value for a person? That's the average in their group, based on whichever combination of X variables is relevant for them. That should just end up being the same thing as the sample average. Right? But as we move into multi-level world, so imagine we took that same data, we split it up into each of these strata, much the same as before, but now we're going back up. We've taken those averages from each group, and I've now plotted the averages. So the grand mean is like the average of the averages. This is now a histogram showing the averages for all of my strata. So here's my grand mean, and around that average across all strata, I have each of my particular strata averages. So I'm thinking about between stratum variance. This is just the visual for the math I showed you a moment ago. Looking within my strata, I've got a bunch of people in there, and they're making that histogram, right? And then I can think about variance within my stratum. So I've partitioned things so that I can think about averages in each group. I can think about averages overall, and I can think about differences across strata and within strata. So I get lots of different things. What this helps with is that tyranny of the averages problem, right? So I'm starting to think about inequalities, not just in terms of averages. I'm also paying attention to the shape of those distributions, which is a much better way of thinking about inequalities. To retreat back to math terms just for a moment, again, I've got my between stratum and within stratum variation. In that first null model, where all I have is my overall grand mean and then some variation between them, this variance essentially becomes a measure of inequality. It's just a measure of inequality that's expressed in a variance form. You can also take that and convert it into something like, for those who are more, quant-oriented, an ICC or a VPC, variance partition coefficient. This is allowing me to think about these inequalities across strata in some sort of total sense. In my additive model, where I've put in Black and woman, but none of the interaction terms, if it was the case that all of the inequalities I saw originally, this whole distribution, was perfectly explained by very predictable universal additive patterns, then putting those beta terms, those additive things into my model should shrink the entire distribution down to 0. If it was perfect, perfectly additive world, the gap for between men and women among white respondents was the same as the men-woman gap for Black respondents, very additive world, then I would see no variation between strata left over after I had explained the additive effects. So more typically, if I just have a very small variation, then that's going to give me how much of my between stratum inequalities were not particularly well explained by those additive effects. On the other hand, if I've put those additive patterns into the model with those additive fixed effects, and there's still a lot of variation, I still have quite a distribution around that average that's unexplained, that means I probably, across all my strata, have some pretty significant interaction effects going on, right? So in a sense, I'm able to get at more descriptors of inequality and how they are patterned. Are they patterned in additive ways? Are they patterned with necessary interaction effects? So when I said originally, I think we can do a better job of describing inequalities, we're getting away again from just averages and average differences to thinking about lots of different kinds of variation patterns. So I did a little hand wave magic trick a moment ago. I don't know if you saw this, but to my shame, I couldn't think of a better way to do it. So here I've got my fixed effects model and I've got my grand mean, my average of averages. I was actually showing you that on the previous slide. The MAIHDA model actually produces this. So I still have a histogram here of each of my strata predictions, my averages. But you can probably notice a difference between the two here. So in my fixed effects approach, I could, in theory, get an average for each of my groups and then make the histogram and figure out what the average of the averages is. This is a grand mean. But MAIHDA is actually giving me a precision-weighted grand mean. In other words, it doesn't just give me the raw average for each strata, even if it only has 5 people in it. What it does is shrink that estimate toward the overall mean, particularly if it's a small sample size. So it's sort of in the background mathematically, it doesn't actually understand because it's not smart, but it is mathematically doing a thing that is smart, which is if you don't have a lot of data, it doesn't trust that result very much. And it's going to give you something closer to whatever is predicted based on the betas. So in other words, what you see in this fixed effects model is some pretty extreme estimates. So this particular stratum here, for instance, has a really low average that's predicted for it. That could be because it just has a couple of people in that group. How reliable is that estimate? Not very, probably. We wouldn't really trust this. And unfortunately, it's usually those small groups that we might be most interested in. You know, we might be interested in the gender and sexual minority, racially minoritized, low income, hard to reach population. And we may only have a small number of people. In MAIHDA, we're going to it's something that might be slightly different from that, but possibly more reliable. It's going to be shrunk in and get a much more realistic estimate for it. So in other words, MAIHDA is going to give us estimates for all of our different groups, but they're going to be much more stable. They're going to be robust to this issue of small sample size, which is a huge advantage. So if I had to kind of put a bow on all of this and summarize, MAIHDA is helping us with those theoretical critiques. So we aren't necessarily reinforcing social primacy of any particular group because we're not saying every group's average is going to be in comparison to that reference category. We end up just kind of taking our betas together and saying, this is the additive expectation and here's the interaction effect for each group. So we're not doing that, that sort of social primacy issue. We aren't giving one primacy over another. We're keeping it very intersectional. We're not going to immediately revert to that single axis thinking quite as badly. And then we're getting interaction effects for each of our strata, not just the ones that we set up to have interaction terms. In terms of the methods limitations, this is where we see a lot of payoff. So as we are adding in more dimensions of identity, more categories, the additive fixed parameters are going to increase, but they're going to do it linearly rather than geometrically. So we get much more improved scalability and parsimony like we saw. We're adjusting for the sample size in each of our groups. So we get improved stability, reliability of those estimates. We are, like I showed you, thinking about variances and therefore avoiding that tyranny of the averages problem. We're getting much easier to interpret results. So that all is great. Here's my one slide on my please remember this, which is what is the difference here? So if you will permit me, a probably terrible analogy, someone walking along the beach. I get this question all the time. hey, I fit an interaction model, and this could be the fixed effects approach or MAIHDA, right? Doesn't really matter. I fit a model attempting to get at intersectional inequalities, and I found my interaction effects are nothing. They aren't statistically significant. Did I just disprove intersectionality theory? Can I publish in a top journal and be like, woohoo? No, no, that is not what that means. I hope you're seeing this now, but conceptually, what this is getting at. The foot here in this analogy is the experiences or the exposures somebody might have by virtue of the position they occupy in these different interlocking systems of oppression, right? So the foot exists. It is a real thing. What we are only ever looking at is the footprints. So we theorize the foot as existing. We're not actually saying much here, especially in quant world, about the foot. We're looking at footprints. We are looking at the effects that those experiences might have on a particular outcome in a particular population at a particular point in time. And there's any number of reasons why the footprint may exist or not, or why it may have interactions that are required to describe it, or maybe it's perfectly additive. It doesn't change the fact that an intersectional experience exists out there in the world, right? So in other words, we aren't actually testing intersectionality theory. It's better not to think of it as a theory that's testable here, and more as a theoretical framework for how we are choosing to set up our analysis. So we are estimating effects of those experiences on outcomes. And then my important caveat, of course, making sure to reject reification and biological determinism. The foot is real. It's not, it is racism, not race in a biological sense. So to the examples, nice and brief, I just have a couple slides here. So through this, I want to show you how is MAIHDA actually helping us to live up to our big goals of a good quantitative analysis. So example number one, here in the United States anyway, I think the same might be true in the UK, but we have quite a lot of concern about opioids and the opioid epidemic. So for this particular study, we were looking at prescription opioid misuse. So not necessarily street drugs, but prescription opioid misuse. And we were interested in understanding misuse patterns through this intersectional inequity framework. So this was looking at the adult, non-institutionalized US population, and just a simple report of past year prescription opioid misuse. So did the respondent say, I used opioids not according to my doctor's prescription? I had 72 strata here. So fairly simple kind of variables that you might find in any large survey. Unfortunately, we didn't have a really rich measure of gender, but we did have sex, race, ethnicity, income, brackets, and age. So 72 different combinations that we could look at. Now, if we think about the US opioid epidemic in general, and that also includes the prescription opioid misuse, and you just crunch the numbers in a very additive way and say, you know, which groups are at higher risk? The things that come up as being particularly high risk might be if you are sort of middle-aged to older, if you are white, if you're a man, if you are sort of on the lower to middle end of the income distribution. So this is what we would expect just based on an additive framework. What do we see when we look at it intersectionally? So all I've done here is plot the predicted probability. So what percent of people are predicted in each of these strata, the labels of which are very tiny down here at the bottom, ranked them low to high. So our top 10 groups that are the highest risk, what do we see? Well, actually, they skew younger. Certainly not all of them are white. Not all of them are men. And we see much more mixed income all the way up to high income. The highest risk group sort of fits our expectations based on additive world. So it's sort of the 18 to 29-year-olds, younger white men who are low income. But the big surprise here is the second highest risk group, which is high income young Black women. We would not predict that at all based on all of the additive work that might be done. And if I were to just put markers here in blue for where all of the other strata are that also are Black women, we see that Black women in general actually tend to be on the middle to lower end of risk of use. So what is it about this strata that is indicating such high risk for prescription opioid misuse? This stimulates a lot of questions. So an analysis like this, once you do it intersectionally with a bit more reliability, can help us to challenge all of those conventional wisdoms about what's going on. Are there high-risk strata we didn't see before? Can we enrich theory? I haven't followed this up yet, but my sense of what's going on is that this is a empowered, younger, high SES group that is more willing to say, I actually have real pain that I'm experiencing maybe post-surgery. And because of medical racism and misogyny, my doctor's not adequately prescribing pain medication. So this might not necessarily be problematic use. This could just be a group particularly willing to go against doctor's orders in order to have adequate pain management. So certainly it's worth following up with some more qualitative work to understand this. Example number 2, I'm sure this is true in the UK as well. Dario, I know you've done a bit of work on mental health crises around the COVID era, but similar question here in the United States. We've been very concerned about the youth mental health crisis. So in this data, this is not yet published. This is just under review right now. We went to the Youth Risk Behavior Surveillance System, and particularly we were interested in suicidal ideation. So in this example, this isn't going to be the sort of typical MAIHDA. We are going to have a random coefficient where we are looking at pre and post 2020. So in other words, what's the intersectional patterning across all of our strata before versus after 2020 and the onset of all of the many disasters that have happened in this time frame? So what we see when we look at it this way is this. So to orient you here, again, we sort of ranked this. This is self-reported suicidal ideation percentages. So 10 to 52% is about the range. Each group is ranked based on the earlier time point. And then, so pre is in the little square, post 2020 is round. And what we see is actually the high and low ends stay more or less the same. The highest risk groups, more or less what we would expect for suicidal ideation. We tend to see a lot of young bisexual women, particularly of racialized minorities. On the lower risk end, very much as we would expect, we see our heterosexual boys of various race ethnicities, closely followed by heterosexual girls. And then in the middle, we have all of these other populations. So not a lot of movement at the extremes, but lots of movement in the middle, sometimes quite dramatic. So particularly for the sexual minorities, bisexual and other sexual, homosexual, and racialized minorities, we see lots of increases of risk. More or less everybody increased or stayed the same. So if you just look at this in the sample overall, you might say, yeah, kids in general got a little bit more, struggling with their mental health in this time period, but really that sort of neutral measure of impact is obscuring an underlying truth, which is that those at the high and low ends didn't move very much, but we saw a huge shift in risk, sometimes as much as 10% shift of percent of respondents saying that they are now ideating, which is a mental health crisis for our sexuality and racially minoritized groups. So this general structure, if you want to take it to a more abstract way, is saying, the effect of something, in this case, those disruptions of 2020, but this could be a policy, this could be, any number of things of interest, the impact of that on some outcome like mental health and how that is different across different strata. So you can expand MAIHDA into thinking about random slopes and random coefficients in order to think about effect measure modification or mediation, to integrate policy contexts or built environments, to think about longitudinal studies or regression discontinuities, changes over time. So you get a lot of stuff out of this. So my final slide, hopefully you've sort of seen this in the previous examples. How is this helping us to do a better job of a quantitative intersectional analysis? Well, those fundamental analytic goals, we can map our averages or probabilities across our strata. We can quantify heterogeneity in terms of variation within and between strata. And we can figure out which ones are sort of following additive patterns versus breaking with those patterns. In a bigger sort of broad aim sense, though, we can use this as a tool to challenge those conventional wisdoms, to identify unseen realities or high-risk groups in need of more support. We can enrich our theory. We can avoid that tyranny of the averages problem. And then to bring it home to intersectionality, this is just the start. We should do a good descriptive analysis, but then we should use this as a tool for critiquing power structures and systems of oppression and motivating transformation. So on that note, thank you all so much for listening. I am very happy. I have no particular endpoint here, so I'm very happy to hang out for a few extra minutes in the Q&A and answer any questions that you might have. Thanks for having me today.